Healthcare workers across the globe continue to go above and beyond the call of duty. Here in the Caribbean, the challenges are no different. The physical and mental effects, stigma and discrimination, fear of infection, and overall trying their best to just keep it together. They show up every single day and put us first. This feature shares stories of healthcare workers in the Eastern Caribbean and how they survive.
The COVID-19 pandemic has unveiled that healthcare workers to be one of the groups to be affected heavily compared to the general population. Healthcare workers are about 3% of the general population, in some places less than 2% of the population. However, disproportionately, 1 out of 7 globally infected with COVID-19 are healthcare workers. This change and this impact in our health system definitely affects how we provide services, when to provide services, and with whom we provide services.
The global awareness of the disease that everyone was privy to had us all concerned, especially healthcare workers, frontline workers. At the time, I was not in the position of the Director of Primary Healthcare. I was actually a frontline worker in the heart of it all. So I remember right before the disease actually was, right before the first case was diagnosed on the island, the questions that often, plagued my mind and other frontline workers was, our limited staffing and our fragile healthcare system. We witnessed how COVID-19 basically was causing mass genocide in so many other countries. And we understood the importance of a robust healthcare system to actually combat the disease. And we knew the limitations of the healthcare system that we have in Dominica. So of course there was fear. There was a widespread panic.
During my training, education, and the practice, I have been tested so many times, tested and evaluated on many occasions that I can't even recall. However, with COVID-19, it has tested me professionally, physically, mentally to the uttermost.
It was very challenging for me because it was new to us. I had to be in my position at work. I had to perform duties at the airport and still do my 8 to 4 in the office. So we'll have to go to airport to test everyone that comes through, and at that time, we had flights coming in still, and it was thousands of people coming in weekly, so it was very physical on my body, and it was really rough at that time. When it comes to the mental aspect of it, not knowing it was a new disease for all of us in the Caribbean, well, in the world, so not knowing the impact it would have, being at the airport testing, even though I know I was taking all the necessary precaution, mentally I was still frightened, wondering what if this person have it. Even to test, after you test an island and you find out the person was positive, mentally you're still wondering, I wonder if that PPE protect me enough. So mentally and physically, it was challenging for me.
The impact does not only stem from the patients, but it also the impact on staff, having to deal with patients who have COVID-19, wearing these particular suits, for example, and it's often difficult for people. They have to go back home to their families, and this has certainly been a challenge, I believe, not only in Barbados, but speaking to many of my international colleagues, it remains a distinctive challenge, the healthcare worker and the sort of mental impact the day-to-day work that they're doing, the struggles that they encounter, the difficulties with patients, the aspects of seeing people die with COVID, the stress and the families, whether they may have kids at home, they may have older people at home, and the concerns that people may have in having to go back home with their families is very real, and something that I personally as well have to deal with the staff in terms of counseling them. We have, in that respect, one of the things that we've done in Barbados is to allow workers to have access to both that psychological and psychiatric support.
Physically, I was tired most times because of the amount of hours I had to be working. So in order to combat that, what I used to do is to ensure that when I get days off, I sleep, and I ensure that I've always taken my vitamins and trying to eat as well as I can. Mentally, COVID-19 has impacted me just a little bit in terms of outcome of what it would be, what my patients outcome would be at the end of it, how it would impact my family. But from reading, listening to the news, and getting ideas as to, or information as to what COVID-19 is, it kind of helped me mentally in order to prepare and to deal with COVID-19, knowing that you had the community involved and everybody involved to help you along the way.
I was diagnosed with kidney stones like in January, and I had operation in January and February to take out the kidney stones, and I was like physically weak and I couldn't really do much after the operation. So instead of, and I work at in an emergency room, so instead of going back to the emergency room, I decided to join the task force. And COVID-19 never really affected me physically because I never really got contaminated with COVID-19, which in my case, because I wear PPEs every time I go and interact with possible cases. But the psychological impact of COVID-19 would be, for example, every time I go and do a COVID-19 test, which is in St. Kitts and Nevis, nasopharyngeal swab, after that you start to feel like you almost got contaminated. For example, I would start to have like throat pain, especially when I know the result is positive. You just start to feel like you have certain symptoms, like throat pain, like maybe 2 days afterwards, and you think that you might need to get the test even though you wear all the proper PPEs, the masks, you have your suit, you always protected.
As a health professional, COVID has had, I would say, a significant impact in the sense that the workload has increased, especially with my responsibilities, as well as the mental and physical challenges as well. Working long hours, ensuring that you get your work done, ensure you contact trace, ensure you cover all the grounds that you need to cover.
There were times when we would find out, for instance, that someone that we tested was positive. And like I said, at that time, our knowledge of the disease was limited. So the fear was that, oh my God, did I do everything right? Did I wear my mask properly? Were my eyes covered adequately? Was every entrance point that this virus could possibly get into my system protected? Did I wash my hands? And most times we did exactly what we were supposed to do. You know, we would put on our protective equipment properly. We would remove it. That's called donning and doffing. Wash our hands. But still, just the, I would say, the fact that this was a new disease and the information on the disease was evolving and nothing was truly understood at the time, there was this fear.
The emergence of COVID-19 induced fear and anxiety within me. Fear of contracting COVID-19 and fear of infecting my family members. One measure that was put in place was that I was tested regularly. I also worked at a quarantine site, And at that site, I was able to stay on site, therefore limiting the risk of exposure to my family members.
I was living with my in-law, my mother-in-law, and my wife and our child. The impact was when you are dealing with a positive case, you start to feel a little bit fearful because you don't want to be positive just from dealing with the case. What you have to do, you kind of have to sit down and talk to your family members, let them know that there are possibility of you being in quarantine, you're taken away, you being put in a quarantine site, or they being in quarantine also because they're interacting with you.
I have a son. I live with my son, my 16-year-old son. And what I did was, I had a conversation with him. I told him, well, you know, what to expect. I gave him a little overview of the virus. And I told him, I'm in the forefront and I don't have a choice, I have to respond. I also contacted my mother, who lives with her mother, and my sister. What I did was I started limiting visitation to their homes. And my son and I, we started having limited contact. When I'm out in the field and I get home, I will have to undress outside, and still when I enter the house, not to have much contact with him at all, direct contact with him at all.
I must say that my family have been very supportive. Supportive to the point they ensure that I sanitize when I get home. So at times, once the vehicle pulls up, everyone is at the door with spray bottle in hand to ensure that I'm sanitized. They ensure that my meals are ready when I get home. At times I get home real late, and they keep check on how far I am from home. So once they know that I am close to home, my meal is warmed for me. So I get home, I have a warm meal, and I am at ease.
With regards to family, my family has been very supportive. Of course, there's that anxiety because they, like me and like everyone else out there, is seeing what's going on in the real world. People are dying. People are getting ill on a day-to-day basis. Case numbers are increasing. Healthcare workers, as you see, have also been impacted. So they themselves are anxious, but they have provided that level of support for me that gives me confidence to continue every day in doing what I'm doing as national coordinator.
COVID-19 has impacted my family in all aspects, especially financially and emotionally. Due to this pandemic, some family members are out of a job and anxiety levels are at an all-time high. Due to the pandemic, there has been curfews and shutdowns, and family members have also gotten depressed due to social isolation.
For my family, it was more fright. My daughter constantly would complain not to come home. She would be scared because we all know that it was a new virus disease out there, so we wasn't sure. We was uncertain, and being at the airport working, it was frightening for her. My mother was even scared, more scared than my daughter because of her underlying condition, and she was hearing like, once you have high blood pressure, diabetes, and COVID, you get COVID, you're gonna die. So she was more frightened than anyone else of me coming home, catching anything and bringing it home. So I think it was more about fright for both my mother and my daughter than anything else.
My mom lives with us and she's 78 years old. She has high blood pressure, she has diabetes, she's a cancer survivor. My husband, he has no comorbidities, but I mean, he's my husband. And my kids are all under the age of 10. So they looked to me for advice. They gave me all the support I needed. But I don't think they clearly understood the fear that I was dealing with, because every time I came home, I thought to myself, I hope I'm not bringing this virus home. So they were always there for me. I mean, they made sure that I would have a meal. They would always ask me, how was the day? My mom was always afraid. Every time I came home, she was particularly concerned, and she would always pray.
Healthcare workers are the backbone of the community as they are providing services. If healthcare workers are not protected, the population is not protected as well. On the other hand, healthcare workers also were facing stigma, discrimination, violence, stressful situations because of the COVID-19. This has also impacted the way how healthcare workers provide services to the population. We have to reduce the stressful situation for healthcare workers. We have to embrace them and then commend them for the work they have done.
When it comes to COVID-19, the stigma is real. There's examples of patients that have been positive, and since we live in a small federation, 2 small islands, the positive cases might have I would say, I don't want to go to like acts of discriminations, but acts of hatred, I would say, directed towards them. There are people that actually leak their information on Facebook for no particular reason, I find. And as soon as you find out that you're in contact with a positive, you are in contact with a positive case, people would actually say horrible things about you through WhatsApp, through Facebook. All these media go against you.
As for stigma and discrimination, now, Grenada is a very small place. Somehow, the public knew where the positive case were located. So, some of them had a sense of fear, anger. Anger towards the government, saying that maybe we should have closed the ports earlier. Anger towards the clients themselves, saying that they may have known they're positive and they come into our shows and bringing that to us. Discrimination against me, part of it, yes. At a point, well, they know where I work. So they knew, and sometimes they saw me going in the client's home. So some of them thought I should be inside and not come out. So as I said, I limit contact with persons just to make them feel comfortable.
The effects of stigma and discrimination are far-reaching. In some cases, it cannot be measured. For some healthcare workers, it's at a minimum. For others, it's a constant reality.
I have not personally experienced any stigma and discrimination, but I know for a fact that my colleagues have. For example, some of my colleagues have faced public humiliation. People do not want my colleagues to get on the same bus as them, and therefore it has lowered their morale and the morale of most healthcare workers. One of the measures that was put in place is that wherever you work, facilities are available so that you can shower and do everything there so that you do not have to come out in your uniform so as to prevent stigma and discrimination.
There was no direct attack on the medical professionals. As a matter of fact, we were always thanked and revered. But I remember this one incident where we went out to do a COVID-19 PCR, swab testing of a suspect case, and my gloves, while doffing, which means removing your protective equipment, I removed my gloves and threw it into a trash can in the actual neighborhood. And there was a gentleman at the top of one of the buildings, and he was like, "Pick it up! Don't leave it there! Pick it up!" So yeah, so I guess they had their fears, but it was never a case of this is the the COVID-19 testing crew. These are the healthcare professionals who are always in the immediate vicinity of COVID patients. Let's not speak with them. As a matter of fact, the community did what they could to actually help make things better for us.
Initially, when we heard about our first COVID case, I would say some persons behaved normal. When we started having deaths related to COVID, persons were a bit more cautious, and being cautious, some would actually be afraid of health professionals. I personally had an incident where it was questioned about my health and my children's health, but to have severe discrimination against me, I can't say that I have experienced it.
So the stigma with regards to COVID is real. And I think I've seen this very early in many of the patients. Some people are afraid even to let their workplaces know that they're admitted with COVID. Some people are afraid for their neighbors to find out. And that really defines what the average person out there might think a person with COVID is. Even when we discharge someone, people are still anxious about, yeah, well, this individual, he or she has just been discharged from the isolation facility. I better stay clear of them. I better not go close to them. These are just the reality things on the ground that the average person has had to face, and the stigma is real. And it's something that we really have to pay a little bit more special attention to.
COVID-19 is a new norm for us. We will never get over this, not right now. So my message is to ensure that we help to safeguard and protect everybody's health.
In these times of COVID-19, what I recommend everyone to do is go into survival mode. They said this pandemic is going to last about 2 years, but each and every single one of the islands them have to invest in the people. Invest in the people, and the people them have to have the time to invest in themselves. Invest in education. You can't go wrong with education and agriculture.
Despite our size and limitations to resources, as a region, we have demonstrated that we can combat COVID-19 and manage COVID-19.
As for us in the Caribbean, we just have to take necessary but simple steps that is needed to avoid the spread of COVID.
COVID is real. From what we're hearing, COVID is here for a while, and we have to ensure that we are responsible citizens in every country. We are responsible citizens, and we have to do our part to ensure that not only ourselves are safe, but as those of our families, our friends. And that is why I work so hard, just to ensure that I can do my part, because it's a collaborative effort, it's a team effort. And the only way that we can lessen the severe impact of COVID in our countries is to ensure that we work as a team, we're cooperative with health officials. And once we do so, I believe eventually we should be able to keep a handle on COVID, the COVID pandemic in our countries.
When we say wear your mask, wear your mask. When we say avoid large gatherings beyond 10 persons, we know why, because it's easier to put yourself at risk for spread. What I'd like us to do is to work together as a nation, as in the entire Caribbean, to keep this virus controlled and to protect the countries protect the islands in the Caribbean, basically, is what I'm trying to say. If we all work together, if we all do what we're supposed to do, I think we can continue to protect our Caribbean from the spread and from the increase in the case numbers of this COVID-19 virus.
COVID-19 has dealt a significant blow to the Caribbean and the world at large. Now we're experiencing our second wave, and the onus is on us to come together to try to prevent and contain this COVID-19 pandemic.
You have survived one of the pandemics, one that you've never been through before, or you probably would have never seen before. You've survived that. You've done well. The mental aspect for you, I think, is important. And I think that you need not to be afraid if you have that anxiety, if you're worried about your family, to seek that particular advice in terms of mental health. Apart from that, I want you to understand that COVID is certainly for you was not a death sentence. It needs not either for you to be a problem in terms of how you function within the society. I think you can function as normal within a society. Nobody needs to make you think that you're lesser because you have COVID. Nobody needs to make you think that it was your fault.
In our region, the Americas, 600,000 healthcare workers have been infected with COVID-19. Of this, almost 200,500 have died from COVID-19. This is a tremendous loss for healthcare, for health services in general. We need to work harder to ensure and protect healthcare workers where they are. PAHO and WHO in this region have three. One is to stop the spread of the virus. Two, to save lives. Three, protect healthcare workers. We have been providing training for healthcare workers, providing PPEs, personal protective equipment, and then, where necessary, additional biomedical equipment so that the healthcare workers are well provided the necessary equipment and services. As we move forward in addressing the pandemic, healthcare workers need to be also supported by governments and then health providers in general, and including the general public to protect them where possible from these stressful situations. We need to do more for healthcare workers. They are the heroes. They are essential services with other groups who may have made it to this far to protect the lives of many people. Healthcare workers are, again, the real heroes and the backbone of the health system. Without them, we cannot and we could not protect the public, and we cannot stop this pandemic.
As we continue to ride the wave of the COVID-19 pandemic, all healthcare workers are very optimistic. And with the support of the Pan American Health Organization and the World Health Organization, we can overcome this. Healthcare Workers Surviving the COVID-19 Pandemic is a production of the Pan American Health Organization, Office for Barbados, and the Eastern Caribbean countries.